I wanted to make this video about scoliosis because I don't feel like it's talked about enough. I can't even speak on how bad that pain was.
Hey, it's Jay Leanne, rhymes with A Leanne. Like if you're a fan, comment and subscribe.
Hello, my name is Jaylian. Let's get started.
What is scoliosis? Overview. Scoliosis is a sideways curvature of the spine that occurs most often during the growth spurt just before puberty. While scoliosis can be caused by conditions such as cerebral palsy and muscular dystrophy, the cause of most scoliosis is unknown. About 3% of adolescents have scoliosis. Even though we may not know why scoliosis develops, we do know scoliosis occurs more frequently in females than males. According to the American Academy of Orthopedic Surgeons, idiopathic scoliosis occurs 10 times more often in girls than it does in boys over the age of 10. Scoliosis is very common, more than 3 million US cases per year, and these are the ages that are affected. Babies from 0 to 2 years old is very rare. Toddlers from 3 to 5 years is common. Children from 6 to 13, it's very common. Teenagers 14 through 18 years old, very common. Young adults 19 through 40 years old, very common. Adults 41 to 60 years old, very common. And lastly, seniors from 60 years and up is also very common. Can scoliosis be corrected in adults? Answer: fortunately for most adults who have scoliosis, the condition can be successfully managed without surgery. For some who suffer from an overly tilted or arthritic spine, though, surgery can be very effective at relieving symptoms. Scoliosis causes and risk factors. Some kinds of scoliosis have clear causes. Doctors divide those curves into two categories: structural and non-structural. In non-structural scoliosis, the spine works normally but looks curved. This happens for a number of reasons, such as having one leg that's longer than the other, muscle spasms, and inflammation like appendicitis. When these problems are treated, the scoliosis often goes away. In structural scoliosis, the curve of the spine is rigid and can't be reversed. Causes include cerebral palsy, muscular dystrophy, birth defects, infections, tumors, genetic conditions like Marfan syndrome and Down syndrome. Types of scoliosis. Idiopathic scoliosis is scoliosis without a known cause. In as many as 80% of cases, doctors don't find the exact reason for a curved spine. Congenital scoliosis begins as a child's back develops before birth. Problems with the tiny bones in the back, called vertebrae, can cause the spine to curve. The vertebrae may be incomplete or fail to divide properly. Doctors may spot this rare condition when the child is born, or they may not find it until the teen years. Neuromuscular scoliosis is caused by a disorder like spina bifida, cerebral palsy, or a spinal cord injury. These conditions sometimes damage your muscles so they don't support your spine correctly. That can cause your back to curve. Degenerative scoliosis affects adults. It usually develops in the lower back as the discs and joints of the spine begin to wear out as you age. Signs and symptoms of scoliosis may include uneven shoulders, one shoulder blade that appears more prominent than the other, uneven waist, one hip higher than the other. In addition to visible symptoms, scoliosis may lead to lower back pain, back stiffness, pain and numbness in your legs from pinched nerves, fatigue due to muscle strain. Treatment depends on severity. Often, no treatment is necessary. Sometimes a brace or surgery is needed. Devices: back brace. Surgery: bone grafting and spinal fusion. Self-care: physical exercise. Therapy: stretching. Mild scoliosis is often managed simply with exercise, medical observation, and scoliosis-specific physical therapy. For some people with scoliosis, yoga is also recommended to decrease their pain level and increase flexibility. Moderate scoliosis often involves bracing to stop the spine from curving further. And now I am going to tell you my story and my experience with having scoliosis.
So now I'm gonna tell you my story. So basically, I've had scoliosis since I was probably a teen. So I was about 12 to 13 years old when I found out that I had scoliosis. It was via a doctor, and it actually did a few things to me. Like, my pain levels isn't like other people's pain levels. My scoliosis is probably not as painful, but about 3 to 4 years ago, I've had the most painful scoliosis of my life. Like, I cried, I couldn't get up, I couldn't move, and it was lower back pain. I can't even speak on how bad that pain was. I remember it today, and it's like my whole body just shivers. Like, I get goosebumps because it was so painful, and that was the most painful scoliosis I've ever had in my life. And from a scale of 1 to 100, I'd probably say scoliosis for me, like the pain level for me, is probably a 5 because of the fact that I've never really had pain in my life until that happened. So other than that, scoliosis hasn't really been giving me much issues. But another problem is when it comes to clothing, like certain dresses and shirts and things like that. Like, one side of my back will usually poke out, and like when I was younger, this used to make me feel super duper insecure. Like, I was like, oh my gosh, like if I wear a dress, like, are people going to basically see that I have a deformity in my back, or like if my spine's a certain way? Like, that's how I used to feel when I was growing up. So I used to basically wear dresses with probably a jacket over it or something because of how I used to feel. But nowadays, like, I don't really feel insecure about it, but I still do like to wear jackets and stuff. But right now it's kind of different. It's not like a, oh my gosh, I'm so sad about this. It's more like a, well, this is who I am, this is how I am, and I accept myself for who I am. And one thing that I would really love one day is to actually work with a scoliosis brand, like a clothing brand. I would love to work with a scoliosis clothing brand to see how it's like to actually wear clothes that actually fits me and complements me and my scoliosis. Because all the clothes that I wear, they kind of don't do that. Like they're just made for people with normal backs, you know? Like my back isn't normal. Like I don't have the normal straight spine, you know, like I have a curve in my spine that I didn't create, that I can't get rid of. Sure, exercise does help a lot with, for instance, the pain. Like if I may ever really have light pains, like my pains is like a 1 on a 10 scale. Like it's almost non-existent for me. So certain people really do suffer with scoliosis. They go through a lot. Like I have not suffered as much as some people have out here. And another thing I wanted to say is I wanted to make this video about scoliosis because I don't feel like it's talked about enough. I don't feel like people know about it. So I wanted to basically make an educative video about what I have. And the next video that's coming up is actually about another thing that I have. So hopefully you'll be able to also get education and basically be informed about something known as GERD, because I'm going to be touching up on that as soon as I'm finished with this video. And with that said, don't be too problematic, be as polite as possible. I'll see you next time.